Hello, everybody. I'm Rob Wallace. I'm an evolutionary epidemiologist with the People's CDC, here with an update on the COVID-19 pandemic. In the graph in red, the Johns Hopkins Coronavirus Resource Center reports a continuing decline in world COVID to 3.6 million new cases for the week ending May 8th. That's good news, but that's still over 3 million new cases in a week's time. The number of global weekly deaths there in white continues to decline, down to a little more than 15,000 deaths for the week, the lowest level since March 2020, when SARS-2 went pandemic. The number of vaccinations administered this week there in green declined to 70 million new shots administered worldwide. Global declines don't mean every country's COVID is disappearing. This New York Times map shows that we still have hotspots over the past week in Europe, Asia, and Australasia. France, Germany, Italy, Portugal, Austria, Greece, Finland, South Korea, Taiwan, Australia, and New Zealand continue to be epicenters in average daily new cases per 100,000 population. The US, Panama, Costa Rica, Spain, Ireland, and South Africa hosted increases in daily new cases this week. By this Our World in Data time series of daily confirmed COVID cases per million people, the present hotspots are trending in different directions. Taiwan appears suffering its first real surge this pandemic. Australia, Finland, and Portugal appear stuck in epidemic cycles. Germany, there in the brown, testing still at 30% positivity, is showing a steady decline in new cases per population. Panama and Costa Rica are seeing new increases. We see for these countries a convergence on death rates matching pre-COVID years. 2 weeks ago, the US, for instance, reached a negative percentage for the first time this pandemic, with fewer deaths now than before the pandemic, although that was immediately reversed this past week. South Korea stopped reporting once it reached an excess of nearly 20% more deaths during the Omicron spike than before COVID. But that has likely reversed with Omicron in decline there. But Australia, Portugal, and Germany have kept chugging along with a steady excess mortality, although not nearly what some countries suffered in the early days of the pandemic or under the Delta variant. With 3 million new cases a week, COVID evolution continues. New subvariants BA4 and 5 we discussed last week have spread across to 16 countries each. Turning to the US, by cases per 100,000 population this past week, the Northeast and Puerto Rico are still entrenched in widespread outbreak. The Midwest, particularly Minnesota, Wisconsin, Illinois, and Michigan, is hosting a widespread increase in caseloads, with select counties suffering Northeast-like outbreaks, as also appears the case in Appalachia. California, Florida, and Hawaii are also hosting widespread increases. Washington State, Alaska, and southern Texas have shown declines in caseloads this week. Here are the levels of SARS-2 detected in the wastewater that comes through our sewage plants. The CDC compiles these reports showing for April 24th to May 8th high levels there in orange and red in the Bay Area, Colorado, northern Illinois, and North Carolina, with new increases in Colorado and Ohio. It's important to note that not all states are tracking and reporting wastewater testing. New York and Florida haven't reported in lately, despite hosting documented outbreaks. The changes in SARS-2 detected in these sewage plants over the past 15 days show here in red some sites around the country with increases over 1,000% or more, particularly in Illinois, Wisconsin, Ohio, Michigan, Missouri, Colorado, Idaho, Southern California, and the Northwest. In other words, large increases were reported nearly everywhere except the Northeast, which remains in a steady outbreak. Carnegie Mellon University offers daily reports of surveys conducted in selected U.S. counties of COVID symptoms. Here's the map as of May 9th. Like the wastewater maps, it is intriguing, although geographically incomplete. This map also depends in part on self-reporting. But compared to last week, there appear increases in California, Michigan, Maine, and Central Florida, with a steady increase nationally from 1.3% symptoms reported March 11th to 2.5% May 9th. The Omicron variant has a reputation of a relatively benign infection, and we see here hospitalizations requiring an ICU bed are flat for most of the country. We also see, however, some areas of the country with upticks of 2% or more ICU beds filled in the past week, indicated here in blue. How much more than 2% CDC does not report. Compared to last week, we see new increases in California, Oregon, New Mexico, southern Texas, Arkansas, Wisconsin, northern Michigan, upstate New York, and Vermont. Here's the CDC's community level map, which, as we have discussed, depends on the lagging indicator of hospital capacity. Even under the bright sider of a measure such as this, the U.S. is increasingly moving out of low level to medium and high exposure in the Northeast and beyond. You have to dig around the CDC's website to find a map of its previous alert system based on actual community transmission. This May 5th transmission map shows that the Midwest has joined the Eastern Seaboard in full outbreak. So while the community level map shows 88% of U.S. counties under low danger, the community transmission map here shows 80% hosting high transmission. CDC includes a note on its website that community transmission is supposed to help healthcare facilities only, perhaps to help such facilities plan for new surges. We at the People's CDC propose such a transmission map could be better used to inform the general public when needed precautions, such as mask wearing, would be pursued to keep such surges from happening in the first place. After all, the emergence of dangerous variants out from underneath our presently lax interventions remains a threat. As we discussed for the rest of the world, SARS-2's evolution continues. Here, stateside, the new BA2.12.1 variant we talked about last week now accounts for 33% of new U.S. infections. COVID complications, likewise, continue to compound. The World Health Organization has announced hepatitis infections in children that some researchers are hypothesizing are an outcome of pediatric COVID. Presuming children unaffected by COVID, part of the argument for ending public health interventions overall, was never supported by data. Vibhu Parcha and colleagues reported in 2021 that 16% of infected children suffered respiratory symptoms and 14% gastrointestinal symptoms, with the relative risk of hospitalization greater in Black and Latinx children than in white, and with 75% of pediatric COVID deaths in BIPOC children. An albeit small proportion of asymptomatic infections in children also progress to multisystem inflammatory syndrome. The CDC appears aiming to debunk the connection between pediatric hepatitis and both COVID and COVID vaccines, instead focusing on another virus, the adenovirus. Researchers elsewhere in the world, however, claim the COVID-hepatitis connection a viable possibility. Indeed, work back in 2021 here by an Italian group reported the connection in one patient. There appears a widespread instinct to separate out COVID-era problems, or to blame efforts to control COVID for the comorbidities that may suddenly surge. Conscious or not, the effort acts as a post hoc rationalization for why we didn't commit to fighting a pandemic that has killed as many as 15 million people worldwide. For instance, in reporting on the drug overdose record the U.S. hit in 2021, the Associated Press wrote, quote, "Experts say the COVID-19 pandemic has exacerbated the overdose problem as lockdowns and other restrictions isolated those with drug addictions and made treatment harder to get." End quote. But we need ask why jurisdictions from the federal level down to the local level refuse to set up public health programs dedicated to reaching these drug users during a major pandemic. Those refusals or omissions are as much a cause to consider as COVID or efforts to control the virus. And that's this week's COVID report from the People's CDC. You can learn more about the People's CDC and read this week's COVID weather report at peoplescdc.org.